For the mess, yeah, it is. Just
No,
one.
that's fine. That's fine. So, hi everybody. We are here today to discuss about pediatric vaccinations that have started from today in India for the age group of 15 to 18 years. I have with me a wonderful, renowned pediatrician joining me all the way from Bengaluru, Dr. Chetan, who is the Senior Consultant Pediatrics and Pediatric ICU with Aster Hospitals, Bengaluru. Hi, sir.
Hi, Dr. Mahima, and hi to all the viewers who are there with us. And it's a great opportunity to discuss a very pertinent issue in today's times.
So, sir, a lot of parents have been, having a lot of questions whether it's okay for them to go ahead and get their children vaccinated, and which is the best vaccine for them to go ahead with. So, why don't you first guide us about what are the latest guidelines by the government of India about the pediatric vaccinations for the age group of 15 to 18 years?
So the whole idea of pediatric vaccination is primarily to prevent serious illnesses, either in adults as well as in children. Now, the age groups from 2 years onwards, when our immune system starts maturing, till 12 years, till up till almost 15 years, is a kind of an at risk gray zone where we do not know the exact effect of the vaccines on providing protection, the safety of the vaccines, and how it is going to tamper with the immune system of the child. So, because the vaccines have been safely given, initially we started off with more than 60 years, then we brought it down to 45 years and more, and then we opened it up for 18 to 45 years. Vaccines world over, whichever brand we have used, have shown 100% efficacy in terms of bringing down the complications of COVID, the rates of hospitalizations, and preventing ICU admissions. Now, when almost 70 to 80% of the adult population have received at least one vaccine in the country, and almost 40% have received two vaccines in the country, when the vaccine is in circulation, now the vulnerable population which is there is this 0 to 18 years of age group. Now, even though the incidence of COVID in this age group was little less compared to that in adults, but more and more children can become victim to this COVID, and we do not know how serious, and also we do not know what is the other after effects of the COVID. Like we see the MISC or multi-system inflammatory disease or long COVIDs, which are later complications of COVID. So, with that logic in mind, and also knowing that 40% of Indian population is less than 18 years, it is very important that we give adequate protection to this population as well. Nobody is protected till everyone is protected. So that's why the government of India decided to reduce the age group of providing vaccines to 15 to 18 years to start with. And then once this cohort of children is vaccinated, then we will come down to around 12 years. So the vaccine drive was started from today, that is 3rd of Jan. The vaccine chosen to be given was Covaxin, which was at the dose of 0.5 ml intramuscular, which is the same as that is for the adults. The dose interval is 4 weeks, and the registration will happen through the CoWIN app, which most of the adults would have downloaded and used it to get their own vaccinations. The same app can now accommodate almost 6 registrations on the same phone number. So it is happening both online registrations as well as on site registrations. And anybody who was born before 2007 is eligible to get these vaccines, and they can seek out the government centers as well as private centers with a payment.
Lovely. And so, if we talk about the incidence of COVID in children, so if the parents are vaccinated, then how are they at risk at home? Because if parents have taken both the vaccination doses, is it still risky for the children to catch COVID? Because a lot of parents have this question in their mind that if parents are vaccinated, then the risk of the children getting it is quite lesser. So, is it still important for them to get their children vaccinated?
Yeah, that's a very important question. And what we have to generally understand is that vaccine uh, prevents the disease from becoming complicated. It does not prevent the infection. It does not prevent the carrier state. So till now, the injectable vaccines, whatever are there, it doesn't prevent the carrier state. So Adults being vaccinated does not give an automatic protection to their children, because they may still
Hmm.
carry the virus if they are working parents, if they are going out and then get exposed to any COVID infected person. Then it is very highly likely that they will come back and infect the children as well. So in the first wave, we saw almost 0.5% of children less than 14 years get affected. In the second wave, however, it jumped to around 11 to 12%. So 20 times increase. And that was primarily because the
Yeah.
total number of adults who got infected was significantly higher. And just by
Hmm.
that virtue, the number of children who got affected was also more. So
Hmm.
it is not enough for parents alone to be vaccinated. It is also important for children to be vaccinated. Otherwise, they will keep on carrying this virus, and with the vaccine waning immunity of us per se, the chance that the infection is going to remain in the circulation and go on for a very long time is very, very high.
Right, right. So, and also, if a child has, tested positive for COVID in the past couple of months, what is the buffer period? How much time is needed for a child to be COVID free until they can go ahead for the vaccination?
So the right now the guidelines after COVID infection, usually the passive protection which the COVID infection provides is close to 6 months. 3 months definitely, but the vaccine guidelines is if a child has got infected, then after 6 weeks he can be given the vaccine.
Right. And what about the common signs and symptoms of COVID that is seen in children? Is it anywhere different from the one seen in adults? And a lot of people also say that, kids have, they're showing milder symptoms as compared to adults. So, any common signs and symptoms which parents need to be careful with that can be seen in children, and it could be COVID, and they must not neglect it and get their children also tested if these signs and symptoms are found in children.
So almost 98% of the COVID infections are asymptomatic. Other 2%, it is mildly symptomatic. That means simple cold, cough, body aches, general irritability. Very rarely they will progress on to having persistent fever and breathlessness, especially in children who have got other comorbid conditions, especially like diabetes, asthma, or they are on cancer chemotherapy. Then it can be a little bit more um,
Hmm.
profound symptoms which they need to watch out for. There is no classical symptoms which will tell us this, yes, this is COVID. It behaves like a common flu, which is there in these winter seasons, especially. So, any infection which is not subsiding after a routine medications, we need to go ahead and get the children tested. Don't panic, just get them tested, home isolate yourself, and any flu like infection, unless proven otherwise in the current pandemic times, it is okay to assume that it is COVID. Mask up, isolate yourself, do not send your children to school. And if the symptoms are persisting, then get yourself tested. With telemedicine coming in, it is also important to reach out to your doctors and seek their consultations on a daily basis. Tell them how the symptoms are evolving, and then take them for a check to the hospital if the child is extremely febrile, he is not eating at all, he is having some form of breathlessness, and the saturation on the pulse oximeter is showing below 94. So if these signs are there, it is better to get themselves tested in the hospital and for a physical checkup. Otherwise, I think treat it like a common flu, mask yourself up, isolate yourself, and then if there is similar symptoms in the family, it is okay to get yourself tested.
Right. And what about the post-vaccine period? Any common side effects that could be seen in children, or is it something similar to what was seen in adults post-vaccine?
So the vaccine which is currently approved for children is a killed vaccine. Killed vaccines are have been present for last 100 years. We have used that technology, and its safety is very well known. And that is the only reason why we are using Covaxin, which is a killed vaccine. And we are not using the other vaccines like Covishield, which is against a protein spike, which are not using the mRNA or DNA based vaccines yet. because killed vaccines is a known technology. We have other vaccines like the injectable polio, the normal flu vaccine. All these are killed vaccines, and the technology exists. It doesn't cause any serious short term or long term side effects. However, we do have these children having soreness and pain at the site of infection, and maybe one day of little body aches. Out of almost 525 children who were trialed for these vaccines, almost 70% of them developed these local signs, and almost again out of those 70%, 80% of them, the symptoms lasted only for one day. So you can the post vaccination. It is better to rest your children for at least 1 to 2 days, and then they will be back to normal.
Lovely. So I think it's just like any other immunization seen in children. Parents need to consider this as important as other vaccinations. It is important for the safety and the health of the child. And I think that parents should take the responsibility of ensuring that they are taking their teens along, they're getting them vaccinated on time, and they're not missing out on the second dose, which is also equally important. Any special message for parents, sir, from your side?
So, a lot of parents ask, if you say children are not going to be affected more, or if the infection is mild, why vaccinate my child? Why subject him to the vaccination per se? So, the few things as parents we should realize is that, as I told, India hosts around 40% of the population is less than 18 years. They will become the carriers of this infection, which will prevent the COVIDs from disappearing even in 1 year, 2 years, 3 years as such. So it is important that this important group of people in the population are vaccinated and protected against COVID. COVID does not affect children. That is a known fact. But the post-COVID infection complications, which are MISCs and sometimes longer complications, we do not know how it's going to pan out. How the heart is going to get affected, lung is going to get affected, brain and the blood vessels are going to get affected. Vaccines are safe, and vaccines are known to protect against serious complications, hospitalizations, and ICU admissions 100% of the time. So when we read about reports saying that this vaccine is 50% efficacious or 70% efficacious, those are mathematical models. All the vaccines uniformly have provided 100% protection against serious infections. Most of the serious infections in children and in adults in the ICUs in today's London or US, where you see, are predominantly among unvaccinated population. So vaccine is very, very important both for personal protection as well as family protection as well as protection of the country as such.
Amazing. And so, what about other countries? Any other countries where vaccination for children has opened?
Yes, the Western world has already opened up vaccines for as young as 2 years and above in the US and UK. So our colleagues there are saying that children have been vaccinated. Most of the Western world has come till 12 years of age, and below 12 years, very few countries have gone ahead and vaccinated. But the platforms and the type of vaccines there have been different. They also have been associated with a little bit more complications among these vaccinated children, especially blood clots and myocarditis, or what we call inflammation of the heart. There were some studies from Israel which brought about that, and that's why the worry of cost or the risk versus benefit of vaccines was in great discussion. But the Covaxin, which is a kill vaccine, which is a platform which is being used for last 100 years with absolute safety record, with the intention of preventing ICU admissions and hospitalizations, is a safe choice for India and for Indian children.
Right. And so, what do you think about the booster dose? When do you think that's going to begin for adults?
So the adults at risk more than 60 years with pre-existing conditions also, already beginning, I think from the 10th of Jan. This is mainly for adults more than 60 years who have finished 9 months since their second dose of the vaccine and who have got some pre-existing condition as well. So that booster is going to initially be for that risk population, along with healthcare workers like doctors and nurses, and frontline workers like sanitation, police, and all the other support staff who are in the field taking care of everybody else. So that's going to start soon.
Right. So it's not just the children, even parents need to be careful for the grandparents in the house. Please take them for the booster dose once that begins, and for all the frontline workers as well, please ensure that you also get the booster dose for yourself, and at the same time ensure that your teens, especially between the age group of 15 to 18, is taken care of. You take them for the vaccination, and also you ensure that you don't miss out on the second dose, which is equally important. So, sir, thank you so much for the lovely information that you've shared. And I'm hoping that more parents will understand the importance of it and are not just going to think about that, maybe the COVID vaccine is not that important for the child because children generally tend to suffer with mild symptoms. It is equally important for children as much as the adults. And together, it is all about reducing the incidence of COVID across India so that eventually we can overcome this pandemic and we can start having a normal, smooth life as soon as possible.
Absolutely, looking forward to all that.
Yes. So, sir, thank you so much. And also, just to share information with the people, is it available in Aster Hospital in Bengaluru?
Yeah, Aster Hospital. There is a slight delay in the stocks of the private hospitals as of now. I think
Yeah.
within a week or so, these private hospitals all over the country will be stocked up with Covaxin. Right now, it is available through government channels and government hospitals. But I think maybe in a week and beyond, we should all the hospitals in Bangalore as well as all the major metro cities will have access to vaccines.
Superb, lovely. So then, if parents want to get it done from the private hospitals, so very soon the vaccine is going to be available in Aster Hospitals, Bangalore as well. So thank you so much, sir, for joining for this lovely chat, and hoping that together we will spread more and more awareness on all the issues related to children and the health and safety of children, especially to ensure that parents are doing everything right for their children.
Thank you, Dr. Mahima, and thanks for having me on this platform. And it's lovely to speak to you, all your followers, and on your channel. Thank you so much.
Thank you so much, sir. Take care. Bye
Yeah.
bye.